position, you apply a hot towel on the face. Make sure it's not too hot, and you have two different ways you can fold it on the face. You can fold it around like this, allowing the mouth and nose to be open for breathing. You compress the towel against the face because it's the heat that we want to be transferred to the skin, so that the capillaries will increase in volume to handle the blood that is now flowing more into the face. You can apply 1 to 3 to 4 towels, doesn't matter. Over a period of time, you could either start to massage the face right away, or do a whole preliminary milking of the body blood down towards the face by starting up by the feet and going up the calves, the thighs, the abdomen, and the chest, to actually increase the amount of blood in the face before you actually start to exercise the face muscles. But in this specific video, we're just going to attack the meat of the face massage that is about 30 strokes. The first thing after you take the towel off is kind of neatly and gently clean off the face with the towel. Do you have contacts in?
Yes.
Okay, when people have contacts in, either they take them out or you avoid the eyes entirely, because you just don't want to disturb or rake the skin across the contacts.
They're kind of sleeping. They're in there good.
Okay, but I'll just do a little demonstration. I won't do the eye strokes. Okay, now, after the towel comes off, you get oil in your hands. You now get a oil or any kind of cream that serves as a lubrication, so that when your fingers are slipping over the face, that you're not tugging on skin. There's a whole range of material that you can place on the face for this specific part of the face massage. Right now we're using simple vegetable oil, just to show that you can just use home stuff. It's knowledge of this technique and working on the face that deals with exercising the face is what's the most important to pull out of this video. First thing that I'm doing is spreading the oil on the face. The strokes that I do on the face are after I've learned over a period of years of doing this face massage. So anything that I'm doing, I'm pulling the muscles either up or out to the side, or within a degree of range between going out to the side or up. None of my strokes are going to actually push the face muscles down. Gravity is already pulling us down constantly. The whole purpose of this face massage is to show how we can balance that pull by a workout on the face. Now, around up here, the temporalis muscles, if you see what happens, if you would tighten these muscles up, how it pulls the face up. Notice as at about the age of 25, our face starts to disintegrate, and with the pull of gravity, maybe about the age of 35, we start to see the effects of stress on the face or lack of nutrition, and our face starts to drop in these areas. The whole purpose of this face massage and exercise program is to start to train the muscles to go back up. One of the neatest strokes, it's the last stroke, is this kind of a stroke, which actually pulls that area up. That's after you've had lots of blood. And you'll notice how much younger a person looks. That's what we're working on, is to get this natural pull up. And like anything, you exercise a muscle consistently, that's how it responds. And in these 19 face muscles, the more we exercise the face, the more these muscles will tone up and hold. Right now, we've been allowing blood to rush into the face. You'll see that there's blood locating in the cheeks. It varies on people where you see the blood accumulate. What we want to do now is push the blood into the whole face structure. And this is what the first part of this these set of strokes are called face rejuvenation, meaning we're rejuvenating the cells with blasting in a whole bunch of blood and nutrients. One of the things that you have to notice is the placement of the carotid artery. The carotid artery runs up the side of the face here and is a major feeder of nutrients and blood to the face. As the blood comes up, it starts to drop down towards the heart. It comes up on both sides. What you do not want to do is ever keep hands on both sides of the neck or even on one side, because it could cause, in older people, some reaction. You want to let this material, this blood flow area, be totally unrestricted. How we enhance bringing blood in the face is by milking, and it's like wind hitting the surface of the ocean and the sea, and you just kind of gently milk the carotid artery and start pooling the blood right here where we get jowly. And as we pull it up, we collect more blood, and then we pull it up in a stroke that's much like a half of a horseshoe, and then goes up in the center of the forehead. And we do that to both sides. And again, we're not like wind hitting water on a surface. You're just gently milking the molecular flow up towards this area, side of the jaw, and drawing up, not hitting the eyes in any way, coming up in a half of a horseshoe fashion, and going straight up. We call the successive stroking up the carotid artery and up the side of the head and up the center here, called the milking stroke. And we normally do 2 sets between each 2 different strokes that we do on the face. Like if we were to work out the body, we would call it a superset if we went from one set to another set of a muscle, and then we would rest. Well, the rest part is the actual milking process that we're doing, and we do about approximately 10 strokes on this side, and then milking up, and then milking on this side 10 strokes, milking up, then repeating once more on both sides. All right, under the list of strokes, and we have the name Hamilton Conan on this page, it says face rejuvenation. Again, that constitutes the first 25 minutes of the face massage. The first stroke that we do is called the fan stroke. The fan stroke assumes that you've had the feet elevated for a while and the blood's flowing here. Now, if the blood starts to back up because of the neck muscles are tight, etc., we need to start to loosen those things up, and we do what's called the fan stroke. The fan stroke goes like such. The next stroke is called the butterfly stroke. This is a little bit more difficult to explain, so I'm just going to proceed and do it. I think the major thing that you should pull out of this stroke is that if you placed your knuckles right into this section below the carotid arteries, make sure that they're below that, and into the muscle, right at the transition point from the trapezius to the neck. It's just a simple way of getting a vital area that needs to be loosened up. It's called the butterfly stroke. It's more complicated than this, but right now that's all I want you to do. Then the next on the list says milking. So we did 2 things. We did the fan stroke, and we did what's called the butterfly stroke, which is actually this. We're going around the rim of the neck, and then digging our, not hard, got our fists into the corner of the trapezius and the neck. Then we go back to milking, where I do approximately 10, this varies, pulling up. To this side. which I did, 2 sets, is called number 1 chin stroke. Number 1 chin stroke concentrates on this area right here of the chin. You reach under the chin, and you feel the muscle. You place your thumbs down here to block the blood that you're flipping in and back into the chin. You're actually exercising the chin muscle. You can go as many times on this as you want. What you're doing is filling out this chin area with blood and pulling it up and exercising it. The next stroke is called chin stroke 2, or number 2 chin full face, which means you repeat the same thing that you were doing the first stroke, and you wind around the indentation part of the mouth to this area here on the nose. Then you cup your fingers, pressing up. So you scoop around the chin bone, up the side of the face, join to the center, and pull up. So this is chin stroke number 2. Same thing as number 1. Then around, pushing blood into the inner spaces between muscles up to attachment of 3 muscles. Cup your fingers up, pulling up. People make the mistake when they come up to this point here, that when they push their fingers, they're actually pushing the face muscles down. Notice how when my fingers are up here, that my fingers are cupping up, and I draw up. Do not push down. You already have that happening. So cup them up and kind of tuck them under the chin bone, and then gently edge the muscle and everything up, and draw up. I'll do a couple more times. Chin stroke number 1. Chin stroke number 2. Those are 2 different strokes. Then you go back and you do your milking 10 times. Up. 10 times. Well. Now, we're going to zigzag jaw hold. Zigzag jaw hold refers to this set of strokes. We're working on this area right here down to here. It's called the platysma, and it makes an amazing effect on, these set of strokes make an amazing effect on this area right here. You divide the jawline into 4s. 1, 2, 3, 4. You take your 2 fingers of that hand. You feel the muscle underneath the chin bone, and you draw up in the first 4th, and then you hold it with that finger. Then you draw up the next 4th, up, and hold it. What you're trying to accomplish is a pull on these muscles as well as eventually down in here. So you go down the jaw as such. You're reaching under. Then you repeat going back. This is the zigzag part. Underneath, 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 underneath. And then you go back again. 1, 2, 3, 4. And that 4th stroke you use what you've already done with the milking stroke. And you go up. Now we'll repeat on the other side. Divide the jaw into 4ths. Draw up. Hold. Draw up.